So those who don't know me, my name's Billy Joe, and I'm a primary care support officer for the Clinical Effectiveness Group. I also have my colleague Tracy here, who is a primary care support officer, and also Charlotte, who will be monitoring the chat for any questions, or please raise your hands as we go along. So I'm just going to get up the presentation now. So this presentation will be on how to get the most out of searches and reports. So the aims of this workshop will be to provide you all with an understanding of searches and reports. On completion of this workshop, you would have an understanding of coding for searches and reports, how to use searches for performance, and how to use searches for recall, and also how to use our validation reports. So here is an example of our diabetes template, which you all should be quite familiar with. As you are aware, our CEG templates cover all national and local schemes. As long as you're using our templates, all the correct coding will be recorded and will be picked up in our support searches. So I did just want to mention, as you can see at the top here, we do 1 star for QOF indicators and 2 star for any enhanced service payment indicators, just to make you all aware of that. So I'm just going to touch on this slightly, the importance of coding. So does anyone know the importance of coding? If you could raise your hand. Don't worry, I will be going over it as well. So why we code data? So it's for consistency, accuracy, to be able to search for data, to be able to compare with others locally and nationally, to show we are hitting the targets or identify where we aren't, and also for submitting for claims or payment. So I'm going to pass you over to my colleague Tracy, who's going to go over the support searches. If you haven't already copied these over, please do so, as they are the latest version for this year.
Thanks, Billy. Can you see my folders in EMIS?
Yes.
Yes. Okie dokie. Okay, so just to reiterate what Billy said, if you haven't copied over the BHR support searches folder, please do, as that's got all the up-to-date Liz information and also any of the other folders that we've updated. So first of all, you've got your COVID folders. So I'm not going to go into too much detail on this, but you can see that you've got your recalls, your SMI recalls, your follow-up and housebound in here. And also what we've done is, so you can see on the last folder here, it says archive. We're not going to archive it because we're leaving it there so that you can view the numbers for your patients, so they're split by the cohorts, as a lot of practices have found this easier to work from. So as I said, although it's got archive on it, we're not going to be archiving it. I'm going to move on to the Liz folder structure. So it's under BHR CCG local incentive schemes. And at the moment, what we've got in here is your AF, your diabetes, your high risk respiratory and SMI, because this is all we've been told at the moment that's been carried over. So I'll start with our AF ones. So this hasn't changed. This is the same work what you've been doing for the last couple of years, which had the 3 phases to it. So the first phase is the top searches here. So it's case finding for aged 65s and over with no CVD. And of those, the patients that have had a pulse rhythm recorded and patients with an irregular pulse rhythm recorded. So from that, they would then get sent and then they would be diagnosed with AF, which this search is the one that you can use for that. So AF, diagnosis through opportunistic rhythm pulse checks. And this does say payment on the end of it. So you can use that for the payment part. So that would be the phase 1 on the LIS paperwork. And then the second part is the phase 2, which was requiring the clinicians to do the AF care pathways on the patients. This search here is your newly diagnosed patients with AF as of the 1st of April 2021. So for this, you use your population included. As we have a demo EMIS, obviously we don't have patient identifiable data in here, but you would use your population included for that. And so once they were newly diagnosed, they were then required for the clinician to go through the AF care pathway with them. So this is this search. So if they'd clicked the AF, patients had the AF care pathway box in the template, they would appear on this search. And from that, they were required to have these 5 things recorded. So you've got BP, BMI, CHADVASC, care plan, and written information. So what we've done for you, if you right click and go on properties, you will see the timescales for all of them. The BP and BMI can be recorded 3 months prior or on the same day as the AF care pathway. The CHADVASC, care plan and written information needs to be done on the same day as the AF care pathway. And again, so on here, to find the patients that haven't had it done, you would use the excluded list on there. Or you can go to the patient missing criteria for payment and click on the line report, which is underneath. Like I said, unfortunately, because we've got a demo site, we can't show you what it looks like on the AF because we haven't got any patients coming up here. But when I move on to the diabetes, I'll show you what the line report looks like. You've all seen it previously. They also require that the patient has alcohol and smoking recorded within the year. So that's going to be within the LIS year, so the 1st of April 21 until the 31st of March 22. So that's the second phase of the LIS. And then the third phase of the LIS was for clinicians to issue anticoagulation. So the next available search you've got is patients with a Hasbled score of equal to or below 2, because if they were 3 and above, they should have been referred to hospital for them to have the anticoagulation distributed to them. We've got your anticoagulation therapy discussed within 1 month. So the 1 month is of the patient having the Hasbled score done. So again, these are both payment searches, so you can use these to see how you're doing with having it all recorded. And then the last search is your anticoagulation therapy discussed with follow-up. So this is after they've had the anticoagulation given, and if they require bloods after, it's to be done no longer than 6 weeks after they've had that Hasbled score recorded. Does anyone have any questions around the AF? Charlotte, can you let me know if anyone puts their hands up, please? No? Okay, all right, I'll move on. So we'll go to your diabetes searches. So again, these are the same searches as last year, because currently with the AF, diabetes and high risk respiratory, we haven't been advised what your targets are this year. So as soon as we've got them from the CCG, we'll update the searches and we'll update all of you to let you know that they are now available with the target information on them. Your first lot of searches are referring to your 8 care processes. So you've got your diabetic register, and off of that you can see who have had the 8 care processes completed, and you can also see who hasn't had the 8 care processes completed. And you've got your line report here. So your 8 care processes missing criteria. Unfortunately, this hasn't run. Oh, sorry, bear with me. I'm meant to be in a different folder. Apologies. So that's here. So if you view results, you can see, as you're all very familiar with this, as you've been using it for the last couple of years, you've got your everything, all the care processes along the top here of what's needed. So there's your BP, your BMI, creatinine, HbA1c, cholesterol, urine ACR, foot exam, and smoking. So you'll notice there's 2 columns for your smoking. As long as there's information in one of them, then it's absolutely fine. Because you've got a never smoked and then it's a smoking status, it's absolutely fine. And with this, as we normally advise when we come around and do the practice support visits, you'll see for this patient here, for instance, this would be a quick win. So they're just missing a BMI recorded and a foot exam. Whereas other patients, as you can see, this person has nothing recorded and this person just has a BP. So they're still missing, BP and smoking. So they're still missing 6 of the other criteria to qualify for payment. So we always advise go with your quick wins first, something that's easier to try and get completed, rather than when you're coming towards the end of the year, try and concentrate on your quick win ones, the ones that you know are going to come in or go for their blood tests, so you can get the information recorded. Then you've got your free target treatments, which are exactly the same. So it's your BP, your HbA1c, and your statins. But I just want to point out, so with the BP and HbA1c, it's the aged 17 plus, and when it's for statins, it's 18 plus. Does anyone have any questions around the diabetes? No? Okay. So we'll move on to your high risk searches. So again, we don't have the targets for these, but we will let you know once we have them. So we'll start with asthma. You've got your patients on your asthma register, and of those, you've got your high risk asthma patients. So we've got 14 on here currently, and none have had the high risk review button in the template ticked. Your next search is your asthma respiratory completed. So you can use this for payment. And what that means is if they've got pretty much most of the below recorded on here. If they have all of this recorded, they will appear here for you. Then you've got your incomplete high risk reviews, which again has the line report, which there's no information in this, unfortunately, because we have 0 patients on that, but it works just like the diabetes. So along the top, you'll have your criterias of what's required. And if there's a gap in there, then that means that they need to have whatever procedure it is done. We've listed them individually so that you can also see, if you don't use this report, you can see on an individual basis what's missing. Because what you would see is the number you have here in this payment search. Say, for instance, you had 10 patients in here. You would expect all of these, apart from the declined and given, to have the same number as that. So you would expect it to all have 10. So they must have ACT done, so the asthma control score recorded. They have an asthma management plan given or declined, if that's what they choose. This search here is just a combination of these two together. They must have the asthma trigger recorded, discussion about hygiene recorded, influenza vaccine given, needed or declined, pneumococcal given or declined, and a smoking status recorded. So as I said, you would expect the same number in here to be up here also. And then the same goes for your COPD register. So you've got your cohort here, so your high risk COPD patients. And of that, this is who's had the high risk review button ticked in the template. And then who has the full review completed, who hasn't had the full review completed, and then your missing criterias in here on your line report. And for your COPD patients, they're required to have their CAT scoring recorded, COPD management plan given, discussion about hygiene, influenza vaccination given, needed or declined, their MRC scale recorded, their pneumococcal given or declined, have a rescue pack issued or declined, and a smoking status recorded. Does anyone have any questions on your high risk searches? No? Okay, I'll move on to the SMI. So this is the LIS that doesn't follow your normal LIS years, as we know. This started from the 1st of August last year, and it's until the 31st of July this year. And that's your SMI patients. So your cohort is going to be in this search here, SMI excluding in remission. And then of those, you can see who hasn't had all 6 checks recorded. And then you've got your line report here, which I can show you. So along the top, you've got your criterias. They are required to have BP and a pulse rate recorded, a BMI, cholesterol or Q risk, HbA1c or blood glucose, alcohol consumption, and never smoked. So again, with the smoking columns, it can be, as long as there's something in one of the columns, then it's absolutely fine. And again, with these, it's looking at your quick wins. So trying to see the ones that will get you to the payment quicker than someone that doesn't have, like this patient that only has a smoking status recorded. They require all of that. So as you can see here, this patient has everything recorded apart from an alcohol consumption. So what you can do is, if you go back to the search, your alcohol consumption and your smoking status are your really quick wins, which can be done over the phone. You can either do phone calls or you can send out your text messages just to ask them to confirm their alcohol consumption, if they will, and their smoking status. So that's just you know, some quick wins of how to get that, because at this point in time, they would expect you to have alcohol and smoking pretty much at around about 100%. And with the stuff that's been going on within the last year with the pandemic, they know it's a bit harder for the blood checks, the bloods to be done. So as long as you can try and get those up to 100%, and then you can start working on your BPs, your BMIs, your cholesterols, and your HbA1cs. Is there any questions around your SMI?
Yeah, Tracy, Stephen from Granville. Can I ask a question, please?
Yeah, go ahead.
Okay, we had a document come out to us on the 30th of April saying that the LIS work for the SMI, the dates have changed. It's going to be running till the end of June, not till the end of July, because there's going to be a new LIS to run from Q2, i.e. July.
Right, okay. I think you know more than we do, so we will chase that up from our end then.
Okay.
And then
otherwise all the figures will be wrong anyway then, because it's going to be over.
Yes, okay, all right, thanks for letting me know, Sue. We will chase that up from our end.
Okay, thanks, Tracy.
Okay, thank you. There anyone else? No? Okay, so that covers the LIS searches that you have available to you. So I'll just carry on and we'll go through. We have a clinical tools folder. At the moment, we have the Falling EGFR tool in there, and that is currently being piloted in BHR. But if any of you are interested in doing this, then please let us know and we can give you a demo and show you exactly what you need to do with it. So depending what area you're in, either contact myself or contact Billy Joe and we can get that set up for you. We do hope, coming up that we will add some more tools in here for you as well. Then you've got an ethnicity search, which it's the no ethnicity recorded in patient records. So basically what's happened is, due to the pandemic, the CCGs have wanted to know which ethnic groups weren't uptaking the vaccine, because they've noticed over the last few years that the coding for ethnicity has not been recorded. So we supplied you with this search and also the pop-up alert, which hopefully you've all installed and have been using. And again, it's just something that you use at your leisure, and whenever you have the time, you can get those recorded, which again, I think a lot of practices have been using text messages, send it out on text messages to see if they can get a response back that way, which is obviously, it frees up a lot more time rather than people having to sit on the phone trying to phone everybody to try and find out their ethnicity. Then we've got your learning disability folder. So within here, you've got the reviews for the DNA CPRs, and you've got cancer screening. So I just want to touch on this ever so slightly. In here, you've got bowel cancer, breast cancer, and cervical screening. I don't know if anyone's aware, but the age has changed for bowel cancer. It is now 50 to 74, whereas previously it was ages 60 to 74. So this search reflects the change of the 50 to 74 in there for you. And then your next folder, you've got your flu vaccine performance, which obviously starts in September when flu season starts. Then you've got your recall for your flu, which again starts in September. And then we've got some prevalence improvement searches in here for you. So we may have a learning disability, but not on the register, and might have a learning disability, but not on the register. So a lot of people get confused as to what the differences are. So I'll let you know that the may have a learning disability, that just means that they've got a learning disability code, but that they haven't been given any learning disability medications, any medications relating to learning disabilities. And then the might means that they've been given medication around learning disabilities, but they don't have a learning disability code. So it's just have a look over there and see if you get any of your learning disability patients coming to those searches, and then if you just make sure that they're coded correctly. And then we've also added the quarterly refresh searches. So it's just anyone that's registered in the last 3 months with learning disabilities, they'll come into here, and then you can capture them as well and see if they need recoding, or, it might not be that they may not need the medication issued for the learning disabilities, and they're kind of like our other prevalence improvement searches. So it's just, we're not saying this is the problem and this is what needs to be done. It isn't. It's saying just have a look at them, look at all the information behind it, and make a decision as to what needs to be done. And then the last one in the learning disabilities is just your regular annual review recall list. So in here, you've got if they've had their learning disability review done in this financial year, if it's been done in the last 12 months, and if they've had the learning disability health action plan done in the last 12 months as well. So after the presentation, we are going to be sending out some fact files. So there'll be a fact file about learning disabilities, and we'll also send you some information about all of the searches that we've discussed as well. So don't worry if you're trying to take notes or anything like that, don't worry, we will send loads of information out to you afterwards. Does anyone have any questions around the learning disabilities? No? Okay, I'll move on. And next we've got a local pilot projects folder.
Tracy,
Yeah.
Tracy, sorry to interrupt.
That's
Learning disability, which template we are supposed to use it? Because a lot of templates for the learning disability health assessment. Can you tell me which one we are supposed to use it?
Okay, so from when we've sent out in the last week about copying it over, we're doing template MOTs at the moment. So this year, all of our templates have been put back to version 1. So
it will be RP version 1, RP learning disability version 1.
Yes, so all of our templates from when they went active last week will have RP in front of them, and they're currently all version 1 as well.
But the doctor has done it today, but the alert is not going through when they did the learning disability, because when I went through, there was no follow-up diary for the next year one. Maybe it doesn't pick up the alert then?
In the template?
Yeah, there are no follow-up date to be updated when they do the review with the learning disability. So the alerts still pop up after they have done the learning disability assessment.
Right, okay. So Matthew, we'll look into that. So leave that with me and we will come back to you on that one.
Okay, thanks.
Yeah?
Yeah.
Yep, okie dokie. Okay, so you've got your local pilot projects. So this is for practices that are signing up for pilot projects. We've currently got 2 in there, which is the Falls Prevention Programme. And obviously, if you're one of those practices, you'll know who you are. And there's the Aviva Diabetes Support Searches, which is just for Barking and Dagenham. But any future pilot projects we have will go in there. And if you've signed up for it, that's where you'll find the searches. And then next, we've got your PCN IIF searches, so your investment and impact fund searches. We've currently got 2 searches in there for you, and that is for the learning disability health checks, if they've had or declined them. And what we've done is we've put your lower and higher thresholds on here. So for this one, you can see that it's 49 is the lower threshold and the higher threshold is 80%. And then you've got the percentage of patients referred to social prescribing. And this is 0.8 and to 1.2. Now, all of these are PCN targets and not individual targets. And in the coming months, there will be a further 3 searches in here, and they all relate to flu. But we're just waiting for the business rules to be sent to us. As soon as we've done that, we will adjust the searches and then put them in here for you to see, and we will let everybody know. And then next, again, if you signed up for the phlebotomy invoicing tool, not everybody did, but if you did, this is where you find your searches. You've got your April, May and June searches in here, as they extended it because it was meant to finish at the end of March, sorry, and it's now finishing at the end of June. And hopefully these are the ones that you've all been waiting for. We've only just put these in there at the end of last week, and it's this year's prevalence improvement searches. So as usual, it's got all of your QOF registers in there. I'm not going to go into full detail. I'll just show you the asthma one, for instance. So as you can see on here, you've got anyone on a prevent inhaler currently on repeat, but has no asthma or COPD code recorded. So as I said before with the learning disability ones, we're not saying that this is definite, you know, they have to have the asthma code or COPD. It's telling you, okay, there's been an inhaler issued, they may possibly be asthmatic or need to go on the COPD register. So have a little look at all the information in the patient's record and then make your decision. And with these, I would say maybe probably once or twice a year you have to look at these, probably no more than that. You know, you might want to space them out to maybe July, August time, and then maybe have another look around about December time, because then that would give you enough time that if you do put them onto your QOF registers, you can then meet all of the other QOF requirements for that patient before the end of the financial year. Then we're going to move on to your structured medication reviews. So you've had these for a while, and this started on the 1st of October last year. And the searches you've got for these are, so all patients eligible for a structured medication review. So these are your cohort patients. And then of those, who's had an SMR completed, so structured medication review completed. And then I think you'll remember when it first came out, they hadn't allocated a SNOMED code for structured medication review. So we had to give you a code to use, and it was the polypharmacy review. So what we've now done is, it's been available to you for a while, there's this search here, which is SMR needs recoding. So, and the dates in this is the 1st of October 20 to the 31st of December 20. Anyone that comes up in this search, you will need to recode them with the structured medication SNOMED code. Now, this does go quite in depth. So what you can do is you can go through all of these, and if you're wanting to look at the medications individually, I'll just show you, there is quite a few searches on here. So quite a few indicators for you to go through down there. But like if you click on here, it will give you the description. So exactly what the search is looking for. So this one is looking at patients aged 65 or over, admitted to hospital with a gastrointestinal bleed, prescribed an NSAID and not concurrently prescribed a gastroprotective medication. So that's what that search is looking for. So if you click on all the individual searches, when it catches up, it will give you the explanation as to exactly what they're looking for. And then lastly, we are the host of your UCLP searches, and in there you've got your asthma, COPD, diabetes and hypertension groups in there. And so what they've done is you've got your registers, and then of that they have put them into priority groups. So during the pandemic, where the patients haven't come in for their reviews, that is the way that they have prioritized patients. So you've got different groups in all of the different registers for you, different priority groups. So that's about it for searches. Does anyone have any questions around the set of searches that I've just been through?
Hi Tracy.
Hello.
There was a question that someone said, are there searches for child IMS and shingles?
Yes, there is. They are being updated at the moment, I believe. So as soon as they are available, which we hope it is going to be within the next couple of weeks, then they will be put into your BHR folder and we will tell you to recopy it over.
That's fine. That person's got their hand up. I'm not sure if they want to ask the same question.
No, that's fine. I'm happy with the answer. Thank you.
Okay. Say it, Charlotte, no more?
No, that's all so far.
No? Okay. All right, I'm going to pass you back to Billy Joe then.
Thank you, Tracy. So I'm just going to get my presentation back up again. So I'm just going to be running through the check patient function. So this can be found either across the toolbar at the top, as you can see here, or it can also be found by right-clicking on the patient in the included list for this example and go to check patient. So I'm just going to use an example of the 8 care processes of what you would see. So as you can see here, there's no matches for BMI, foot exam, or the BP. So it means that these 8 care processes haven't been completed. And you can see they all say found on the ones that have had it recorded. So sometimes if you're unsure of why the patient's still coming up, you can just go to the patient and do check patient, and this will make it a bit easier for you. And then just before we move on to any questions, we will be sending a feedback form after this session. If you could please complete this and let us know how we did and if you would have liked anything else added, we would be much appreciated. Are there any questions? I'm going to stop sharing my screen now and I'll come back on. Are there any questions? Okay, as we mentioned, we will be sending a fact file as well, just to go over what the searches cover as well. So you'll receive this hopefully by the end of this week, and we will look into the childhood IMS as we know they're being updated at the moment and let you know once they're available. Thank you, everyone.
We got away with no questions. Lucky us.
Thank you.
Thanks.
Okay, thanks, guys.
Bye.
Bye.
I've just removed Samantha because she was hanging in there. Right, she's gone. It's just us now, isn't it?